I'm Ted Owens, and welcome to Mountain Health Today, a program about all things healthcare and issues that are important to the communities that we serve. We'll be back in just a moment. We're going to talk a little physical therapy today. I'm Ted Owens, your host on Mountain Health Today. And today we're going to be talking a little bit of physical therapy. And my guest is Ryan Solberg, Regional Director of Therapy Operations with the Tahoe Forest Health System. Ryan, welcome. Glad to have you here today.
Thank you. Glad to be here.
So before we get into this, I just have to explain a little bit of my own personal experience. I had a knee injury once, the first time I went to physical therapy, and I'll never forget walking in, and I said, so what are we going to do first? And you know what they said to me? They said, well, we're going to bend that knee. I said, oh, no, we're not. But I'll tell you what, it was a great experience, and I'm 100%, so I'm a big believer. Before we get into that, why don't you tell me a little bit about your background in physical therapy? How did you choose this as a profession?
Yeah, it was interesting. I grew up in a family of physical therapists, and my father is a physical therapist that started his own clinic back in the day in Stockton, California. I grew up really working in the clinic since from a little kid all the way up, and worked there in high school all the way through college, and really saw how family operation, how it worked, and then the effect on dealing with sports athletes and patients.
So is this a family operation, or how big?
It started off small, but then it actually became quite a big operation. It started off in an athletic club, so I grew up in that athletic club. And they bought the building next door, and then it expanded, and I pretty much just grew up in that clinic. So I saw really, physical therapy was just part of my family life. So.
Well, that's wonderful. It's interesting. You started when you were young. Would you begin with janitorial services?
I did. Actually, it's funny you said that, because that was my first job, was folding towels. And so I became the fastest at folding towels, doing laundry. And actually, my dad didn't want me to work in the facility working with patients until I was ready. So I always felt like I had to work that much harder to prove that I can be out with the patients. So
I was going to ask you that. So when did you realize that this was a profession that you wished to pursue? Was that high school?
It was in high school, and I actually went through my own injury with a broken hand and had to go through therapy, and I saw it, firsthand there, and being able to see really the amazing people that would come in and the relationships that were built between my family and the therapists and those patients. And to me, that's what stuck at the end of the day, were those genuine relationships that really people felt proud that you could go home and say, I did something that was tangible today, that I made a difference.
And you pursued this educationally. You have an MSPT designation behind your name. So tell me what that stands for. Is that part of your education?
Right. At that time, now most of the programs are all doctorate of physical therapy programs. At that time, UCSF, it's where I graduated from, was a Master's of Science in Physical Therapy.
Okay.
Prior to that, it was UC Davis was my undergrad.
So we'll leapfrog to today.
Yeah.
But before we do, where else have you been before you landed with the health system here?
Yeah, so I just knew that I wanted to be in the mountains right after school. So I grew up I grew up on a ski team coach. So I knew that I wanted to be in the mountains, and I picked North Lake Tahoe was my first job offer. Worked in Incline Village at a private clinic for 2 years before joining Tahoe Forest Health System. So I've actually been with the health system for approximately about 15 years now.
Well, let's talk about the Tahoe Forest Health System.
Absolutely.
Why don't you describe the program? How many locations are there, first off?
Yeah, we have 3 outpatient physical therapy clinics, one in Incline Village, Tahoe City, and our biggest one is over in Truckee.
Okay, and let's get into the staff, the folks you work with. How big a staff do you have, and what kind of backgrounds do they have? Similar to yours or different?
Very similar, and oftentimes when I speak with other staff and how they got into their career, it was usually a personal experience. There have been a few that have had family members as therapists as well, but usually there was a personal experience of either going through therapy and having some type of genuine episode that affected them in their life. And so we're surrounded with incredible, passionate group of people at our facility that have driven them to success. And so we have 3 outpatient PT clinics, and we have an inpatient physical therapy clinic as well.
I think it's interesting that you brought up the fact, both with yourself and with the staff, that they had been patients as well, and that was a driver for folks. So they
Absolutely.
understand both sides.
Absolutely.
Okay, wonderful. Just real quickly, we're going to get into this in the next segment, but what types of physical therapy do you do? Because I understand it's very unique in the array.
Very unique. And going back to we approximately have about 90 employees. We have approximately 40 therapists, all with different specialties, ranging from a certified manual therapist, dry needle specialist, aquatic therapy, wound therapy specialist, vestibular, balance, women's health. We have specialists in literally every niche of physical therapy. And if you can find one, even an unknown one, we have a therapist that's probably developed their skill set such that they've made that their specialty.
Now, we're in a rural environment, so is this type of an array, that's atypical for a rural environment, isn't it?
It is, but we have an incredible group of therapists that have really developed a passion for their particular interests, and we put a lot of education into in money for them to get further in their education beyond just their physical therapy degree to become either credentialed or certified in that particular area. And that's part of our staff development plan, is meeting with them and really discovering what drives them and where they would like to go, and we like to support them in that role.
Are they enthusiasts as well, recreationally, enjoying the environment?
Every one of our therapists, usually on Monday mornings, we talk about what we've done over the weekend and everything, and by the nature of our environment up here, we all partake in our surroundings for sure.
So that creates a level of connectivity with your
and some
patients as well,
competitiveness too.
I mean, and competitiveness. That's a good thing. But very often, I mean, your patients, you understand what
Absolutely.
If they've done some physical activity that's ended up in putting them in your care. You have a relationship right off the get-go.
We know very well that despite their level of athleticism, whether they're a professional athlete or an aging athlete, whatever that definition is.
And that's where we're going to go in the next segment. I'm very interested in the aging athlete category.
Excellent. We're all there.
Okay, will do. I'm Ted Owens. You're watching Mountain Health Today, and we'll be right back. I'm Ted Owens, and welcome back to Mountain Health Today. This is a program sponsored by the Tahoe Forest Health System. My guest today is Ryan Solberg. Ryan, welcome back, and we were talking physical therapy, talked a little bit about your background, and I think we left off after talking about your staff on some of the different types of physical therapy that you have. And you had mentioned, the aging athlete, the weekend warrior,
right.
Which I think I would fall into that category. Tell me a little bit about the nature of treating different generations.
Yeah, I think we're all heading that direction regardless. Even professional athletes that have been a professional, whether it's 3 to 5 years, and we've all seen them up here, but really the bulk and probably 95% of our clientele are athletes that have moved up here for the same reason we moved up here, that enjoy the outdoors and partake in all the activities that we do. And so really we try to treat each of those individuals like they are an athlete, and they are an athlete. But the definition changes over time. It's how...
Don't I know it?
We define that, and whether they're skiing, maybe it's not the double black diamond, and they just want to go out for that hour time. That's the goal that we put in the plan of care, and we want them to achieve that. And I love working with those individuals that maybe aren't as the straightforward ACL, that maybe they're a double knee replacement and they have low back pain and they just had a cervical fusion.
Well, you see a lot of different things. I shared with you for a knee, I've been in for a shoulder surgery and did my PT there. And you have a broad array of different types of therapy, physical, occupational, speech,
Yes.
hand therapy. I didn't even know there was a difference, with hand therapy versus somebody that might be working on my shoulder.
Sure.
So is that what makes your shop unique? And what else makes you unique and differentiates you out from everybody else?
Absolutely. Well, I would say the highlight would be the specialties that we have in the different therapists from the physical therapists. But occupational therapy is its own specialty in itself. And out of occupational therapy, there's been developed the certified hand therapy program that was really developed by Denise Boness, and she really wanted to bring up the level of care for the occupational therapist to become certified as certified hand therapists, and that's very, very unique for the rural area. It takes thousands of hours to get certified. And
so let me interrupt. So what would lead one to hand therapy? Would these be things like carpal tunnel situations and issues
Absolutely.
that you might find in a urban environment, perhaps more than a rural?
It can be everywhere from amputation to carpal tunnel to even extending an elbow and shoulder. And they'll do everything from specialty care, manual hands-on therapy care, as well as splinting, making custom splints. And it's its own discipline in itself. And so you won't see many therapists, physical therapists, work as on hands and elbows as much as now we have certified hand therapists, that is their specialty. And with falling on outstretched arm, being snowboarders has probably been the greatest rise, and mountain bikers.
Not being a snowboarder, I wouldn't know about that. But let me ask you a question here. I took away from my experience better habits at the gym, for example, stretching and what have you. So explain a little bit about the course of treatment that you've initiated there. What does a patient take away
Sure.
when they leave the confines of the therapy unit?
Yeah, so first day is the evaluation day that we receive the order from the physician, and you would come to therapy and we would provide comprehensive evaluation, and from there we would really come into an assessment to determine what your course of treatment should be and to educate you on what the diagnosis is. You know, oftentimes doctors will provide you with the information. We go a little bit more in depth, that we describe more potentially how you receive the injury. We look at the biomechanics, we look at posture.
Biomechanics, for example, well, and I'm working on mine right now. I've noticed you're sitting upright very well. I tend not to do that. But do you analyze an individual's movement?
Absolutely.
Also in their treatment, wherever it is, specific area, but watch how they move and put all that together in a complete...
Probably more so, that's what we have become experts in as movement therapists. We look from the day one, the minute you sit in the chair, and we perform and ask you to come back on first day evaluation. We see, number one, how you are sitting. We see how you get up. We watch your gait. So the evaluation starts literally the second you walk in, and we really get the bigger picture.
So I have to ask this question. You're profiling. So when I see you in the grocery store, I need to improve my gait because I know your eyes are...
Absolutely.
Is that really true, though? Do you never cease to evaluate people wherever you are and how they
Absolutely.
walk or move?
Yeah, and it's my wife and my kids always say that, can you just stop watching people? But we'll go in there and we look, and I say, you know what, I think that person has a leg length discrepancy or scoliosis, but you just learn to love that objective.
What about bad habits? I mean, do you teach?
Absolutely.
You teach good habits with your patients, yes?
Yes.
That they carry with them, whether it's posture or very often with, I know you work with more professional type athletes as well, but some of us who aren't so, we may be doing workouts where we're utilizing a part of our body more than another. We're actually doing more damage to ourselves.
Absolutely.
And so do you have folks like that you work with and
yeah.
retrain?
The minute somebody walks in, we look at whether it's their occupation and if they're sitting for a living, and number one, how they are sitting. We get into a course when we're young, we play and we're active, and we don't develop a lot of these postural dysfunctions until we get into our life as a student. And as a student, then we become, posturally really deformed around our computer and whether we're studying. And so our heads kind of propel forward, and we need to undo a lot of these things down the road. So a lot of this does come on the first day, that we educate, this is where you are now and this is what you can do to improve, and we always make sure that you leave with some type of home exercise program that you can really build into your life on a daily basis.
Well, we're learning a lot today, and I intend to take advantage of that, but we've got to take a break. You're watching Mountain Health Today. I'm Ted Owens, and my guest is Ryan Solberg, and we're talking physical therapy. We'll be right back. I'm Ted Owens. Welcome back to Mountain Health Today. My guest is Ryan Solberg, Director of Therapy Operations in the Tahoe Forest Health System. We're talking physical therapy. Ryan, I've enjoyed it very much. I'm interested in a couple of other things here. We talked about evaluation, treatment, education. Tell me about, what does a home exercise program look like when you have a patient? Is that someone who transitions from your environment to their home, and how does it work?
Right, it's a great question. It actually happens on the first visit. A patient would actually leave on that first visit with a home exercise program that they can do. It's all about patient engagement from day one, and if we don't, we lose them. I think we've all been there, is that we really need to understand as a patient what our condition is, and also how we can proactively do something about that condition. So we really try to build it in and impress it upon the patient on that first visit. This is what you can do day one at home. It might be 2 to 3 exercises. Now, it's actually advanced from just simply drawing stick figures and giving this to patients, that now we have some great tools that utilize smart apps as well, and we currently use one that we're able to push exercises through with videos, and on day one a patient can download the videos and we can customize everything.
Do they interact with you still? In other words, do they maybe work a program at home for a period of time, come in for a checkup to monitor how they're doing?
Absolutely. I think that's down the road as well, is that once a patient has really been discharged maybe from a formal therapy program, from the initial time of the hands-on, we might go to maybe once a week or once every 3 weeks and give them that home program that they can do for 3 weeks. They can call, check in, email, and we can update that program in a 3-week time, or even a month time. So we really want to build patient engagement and not just discharge a patient and not know what that plan is. So we really want to build and make sure that that patient is successful in achieving their goals.
Now, that lane would come to you by somebody that maybe has an injury or something that's developed over time.
Sure.
But you do post-surgical physical therapy, so very often there isn't something they can do day one. You have to begin someplace.
Right.
What does that program look like?
Yeah, well, post-surgical, we do part of our post-management program with the total joints, for instance. We'll engage that patient. We do a lot of hands-on, and we'll bend the knee and extend and do some different...
Don't bring me back to that.
do some different modalities as well, but on that day one, the patient leaves with at least 4 to 6 exercises that they can do themselves. And then we'll always change that program. The home exercise program evolves over time, and it changes, and we'll eliminate some exercises and add on other exercises down the road.
Really, it's a partnership, though. You
Absolutely.
really cannot, nor can anyone in your profession, do anything for the patient who isn't going to cooperate, because it requires that partnership.
You got it.
You've got to do the work, or you don't get the payoff.
Yeah, it's a joint cooperation, and we don't ever look at ourselves as salesmen. I never would want to look at it that way, but we really do have to value what the information that we're giving that individual, and really have them buy into it, and have them understand why they need to do the exercises themselves, and it's all part of the program.
So you do a fair amount of education.
Absolutely.
Now, again, I think what I've heard today is that your team really does it all. I mean, hand therapy, all different parts of the body, post-surgical, injury, or just bad habits. We were talking
Sure.
about that in the last segment. And again, you have locations pretty broad in the North Tahoe area.
We do. We're concentrated there in Incline Village, Nevada. That clinic was started 13 years ago, and we've integral with the Incline Village Community Hospital there, a very tight-knit group. Great facility, and we have a Tahoe City clinic as well that's been present there for the last 20 years. And then Truckee, we've been there for over 30 years, and it's
the
changed locations.
mothership, if
It's
you
kind of the
will.
mothership. And ultimately, when it goes back to specialties, we offer physical therapy, occupational therapy at all 3 facilities, as well as certified hand therapy. In the state of Nevada, they allow us to do functional dry needling. That we have 4 practitioners over at our Nevada location doing that. So that's a service that you might see in Nevada that isn't replicated at the California
So it's very
sites.
convenient for the folks that you work with. They don't have to necessarily travel to Truckee. They
Exactly.
close to home. And are you able to rotate your specialists, your therapists, fill gaps and move around?
That's what we do really well, is day one, if the individual that comes in, we really try to profile that patient from day one and know who they are based on the diagnosis and get them with the right therapist. If they're not with the right therapist, or if we feel that there needs to be an additional member of that team, we'll refer them to another therapist within our clinic, and it may not be at the same facility. So it's very unique and different that we may get a referral from over in Truckee to come and see an individual over in Incline Village for a specific
Now,
course of care.
one word I've heard threaded through our conversation today is team.
Absolutely.
And you smile when you say the word team. You really feel strongly about that, and your group, you really function like a team, enjoy working with each other and with the folks that you're helping.
Absolutely. It's all about team, and that's probably what we do the best, is how we communicate between not just the therapists, the clinicians, but our office staff and the engagement. It's an exciting place to go to work because there's always some type of plan that we're trying to better that care for that individual from day one. And access to care is a big one as well. Try to improve our access to care down to 72 hours so we get a patient in immediately. If they can't get in at one facility, we'll get them in at a different facility, but we ultimately will do the best to get that individual in right away.
And to bring it full circle, when we began this conversation, you shared with me that your family was in physical therapy, your father, and you worked from a very young age in his shop, and you saw the relationship between his facility and the community, and I think it's a wonderful thing that you've been able to bring that in your career full circle. Team you like, people you like to care for, and a really great operation. I've really enjoyed having you here today, Ryan.
Absolutely. Thank you.
It's been good, and I wish you all the best success. And I hope you take no offense to this, but I really hope I don't see you over there at the physical
That's what most
therapy
people
shop.
say.
But at my age, I know I will.
You must have had a good home exercise program.
I had a good home exercise program, very good therapist. So
Excellent.
Thanks for taking the time to join us today. Ladies and gentlemen, Mountain Health Today, I'm Ted Owens. My guest has been Ryan Solberg, Regional Director of Therapy Operations for the Tahoe Forest Health System. Been a great conversation. Thank you for joining us. Ryan, I want to thank you for joining us here today. I'm Ted Owens. This is Mountain Health Today. We've had a wonderful conversation on physical therapy. We hope you'll join us on future episodes. Thanks very much for dropping in on us.